Duly noted, 8/12/2013. Hi, I'm Dr. Kathy Dooley. I have the amazing Chris Anderson here.
I'm Chris Anderson from Calgary, Alberta. I have a practice at a sports med facility there called Talisman Center.
Awesome. Chris is incredible. He gave us a lot of pearls here at NKT Level 1 in Toronto, and he gave a corrective that I love. I've been looking for something a little bit better than a corrective I was giving. What we found was a long head of biceps and extension was just not really giving us the response that we wanted. And we found the coracobrachialis, a synergist with the long head, to be inhibiting that pattern of the long head of biceps being able to do its full job. So we released the coracobrachialis, and we were trying to think of an awesome way to integrate the relaxation of coracobrachialis, this horizontal adductor and flexor of the shoulder, to be able to relax it and be able to integrate the long head being able to participate in extension of the shoulder. And I wanted to be able to have Chris go through that. It's a modified Bruegger's. I want you to have the show. Go ahead and tell them how you do it.
So we're just going to talk about this exercise that can be helpful for all sorts of patients. Basically anybody that has any scapular dysfunction, even with breathing problems, you can integrate this stuff just to help them to get a sense of where the shoulders are supposed to be. Bruegger's stuff was first introduced to me, I think it was in Liebenson's text, Craig Liebenson, Rehabilitation of the Spine. But it might have been Hammer's text, I can't really remember, but I think it was Liebenson. So that stuff was amazing to me. I saw him doing a lot of work with therabands, a lot of wrapping techniques. And then I went to a Claire Frank course. She's a physiotherapist who does a lot of Yonda work. And she started talking about some of those Bruegger patterns and made me understand that it was more about activating the phasic nervous system versus the tonic nervous system. So we all started in this tonic flex position when we're embryonic, right? And then we move towards this movement. So this is phasic, this is tonic, right? All the muscles involved in this motion being phasic. So we're going to start by activating some of our phasic muscles. We're going to keep it real simple. People often make the mistake with this of taking it way too far and not focusing on the most important part, which is finger AB, or yeah, let's get it right, abduction and supination. Okay, so you spread your hands real wide as you can, push your palms through, and turn your fingers to the ceiling. I did a little mistake there because I've made it so effortful that I moved my upper body. I want you to do it softer than that. I want you to just focus on moving the hands, spread your fingers, turn your hands towards the sky, and make sure that you're keeping your fingers real wide. It's not about the external rotation here, it's about the abduction of the fingers and the supination. If you're doing that, what you're going to get reflexively is a little bit of activation of those inferior fixators of the scapula without getting that rhomboid upper trap activation that we always get when we're trying to teach people to keep those shoulder blades down and back. So that's just another piece to add into your toolbox. Really, really effective.
It's lovely. I'm used to teaching Bruegger's,
yes,
but I like this better for shoulder corrections because it limits at the elbow and doesn't force that hyperextension that people like to do, or like Chris pointed out, that ability to elevate, upwardly rotate the scapula. So I really like this one for limiting and pulling those elbows into retraction and then pushing themselves out by letting the coracobrachialis actually relax, reinforcing that, but letting the long head actually engage and participate in elbow extension.
That's an excellent point, keeping the elbows by the body.
Yeah, keeping the elbows by the body. And we want soft gut, soft butt on this.
Exactly.
No
You're
tension
not thinking
through
about
here.
anything else other than breathing normally, diaphragmatic. If you're advanced, maybe thinking about some lateral movement with that, but just keeping it down.
But we're not,
no.
Yeah, right? This is something you can do all day long without having to brace the gut and brace the butt. We want this to be something you can do in the line at the grocery store, to be able to open up the chest, to be able to work this system of the body that's actually going to pull us into a more extended phasic pattern, right? We want to evolve to be upright, not devolve to go back to tonic. So make sure you incorporate this into your day, especially if you show up with a similar pattern. And I hope you have a good day. Bye, Chris. Thank you so much. Really appreciate it. See you later.